He was 59 years old, and he was diagnosed with Alzheimer's disease.
My foot got hard as a rock. You could just knock on it, and it was being discolored, and it was spreading. So I agreed to the amputation of it.
He broke his hip, and he was in a facility for 7 months, and then I brought him home. I got him walking again, and I brought him home, and that's when I looked more into Passport, because I was close to on the verge of a nervous breakdown.
I feel my life is better with Passport than it would have been otherwise, because up until that I got my leg amputated, I had no problems.
People told me he would improve.
Each of the 1,100 older Northwest Ohioans helped through the Area Office on Aging's Passport program has his or her own story. While many of these narratives may start out with disease, depression, and despair, they often become testimonies of improved healing, happiness, and hope thanks to the assistance of Passport. After being diagnosed with early onset Alzheimer's disease, Jim White broke a hip. That's when his wife Jackie called Passport.
As a result, I can take better care of him because I'm more emotionally stable. He's happier. Right now we have 2 different aides coming in regular, which has done wonders for him. He's very comfortable with them, and I don't know what I would do if I didn't have this help. In the nursing home, he was aggressive sometimes, lashing out at staff. And then when I brought him home, he was just more relaxed. The behaviors weren't there. He's happier. My experience with Passport has been a wonderful thing. I have peace of mind. I can take care of myself more, make my doctor's appointments, do things more that I enjoy. And then my time with Jim is a lot better. It's just better.
At 70, Dorothy Cunningham lost her leg. Her prospects for independence were tentative at best, till Passport stepped in with a plan to keep her happy, healthy, and at home.
I've been in a nursing home for rehabilitation, and I would much rather be home. You feel free, and you can relax. Where in a nursing home, you're tense and you're not quite sure. It's just freedom at home. Much more freedom than in a nursing home. No, I'll take home any day. Any day. My leg was amputated. When I came out,
Make sure you remember
Passport was
call you
there.
for that, okay?
As far as I'm concerned, it lives up to what it said and even surpasses it. When I have a concern, I call them. It's not very often, but I call them and I know things will be worked out. And I don't worry about it. I trust them. I'm satisfied.
Just as elected officials know that all politics is local, older adults know that all quality care is local. The best recipe for success at home is often an empowered local Area Office on Aging care manager. They work in partnership with a local home health agency or aide. They know the consumer as well as the community, and they're of the community. ABC Healthcare is one such agency. For over 30 years, this dedicated team has been providing quality home care. But ABC Healthcare is facing the same challenges other provider agencies have faced. Financial pressure to provide care at rates that haven't changed in 15 years. Jack Patel, founder of ABC Healthcare, explains.
The biggest challenge right now we have is getting employees, qualified employees, work for home health care agencies. And that is not only our challenge, that is a challenge throughout the country for healthcare personnel, because we are competing with the industry, industries like McDonald's or Walmart or some manufacturing companies, where they start their wages somewhere around $10, $12, $13 an hour. And they can adjust their rate because they are not tied up to the cost of the reimbursement. What healthcare companies like, oh, we get it. And our reimbursement is fixed. As a matter of fact, we have not gotten a raise for the last 15 years. Matter of fact, it has gone down. And I think as time goes on, if nothing has been done, it's going to be very difficult to provide services to individuals who need services at home.
ABC Healthcare employee Raisha Nayak shares another long-term care trend.
There is definitely a huge push by the insurance companies and also Medicare and Medicaid to take people out of the hospitals faster, out of the rehab facilities, out of nursing homes, and allow them to age gracefully at home, which is wonderful because it provides them to their comfort of home, their own surroundings. They can age with pride and comfort.
Passport is 1/3 the cost of nursing home care to taxpayers. But home care, good home care, should not be undervalued.
If we don't value the people that are in the homes that are taking care of them, and we aren't able as an agency to pay them what they deserve to be paid for the hard work that they put in, such as ADLs, which are activities of daily living, light housekeeping, personal care, which keeps them safe, keeps them able to remain part of their own community, it's going to be very difficult.
Difficult, but not impossible. The funds needed to pay for quality home care should come from the money saved whenever home care can replace a stay in a nursing home. For each older adult that transitions out of a nursing home and on to Passport, the annual savings to taxpayers is about $35,000. By taking the dollars Passport saves and reinvesting them back into the program, future consumers can feel confident that they too will be cared for.
You never know, it came out of the blue. And just, it's something that you don't think about. So people have that mindset, oh, that's not going to happen to me, that happens to other people. But that's not always true.
The Area Office on Aging's Passport program has been successfully serving the needs of older adults for over 40 years. It is a unique partnership that joins older adults, family caregivers, a local Area Office on Aging care manager, home health aides, provider agencies, and the state of Ohio with one single goal: to keep loved ones at home where they want to be. Passport. It just makes sense.